again, we want to make this a lifestyle. We don't want to make this a 30-day, 90-day diet, and then we go back to our old eating habits. So the medication essentially, it just helps you to establish those new healthy eating habits. And the goal is not to keep you on this medication forever. The goal is to help you to get to your weight, I guess you should say, get you to where you want to be, from a body composition standpoint, and then to maintain that, and then wean you off the medication.
Hello, welcome to another podcast. I'm Dr. C from West Chase Miles Institute, and we're super excited today. We're introducing Dr. Nick. He's right here.
Hey guys, how are you? I'm Dr. Nick. Nice to meet you.
And we're going to be talking about weight loss program today, what we did, what we have done, and how it relates to dental, right? So a few questions for you. I
Sure.
Just start off right away. How do people get signed up on weight loss? What is weight loss? Why do the people need to lose weight?
So there's a lot of reasons why people would want to lose weight. Overall, the most important thing is anytime you're losing weight or cutting your caloric intake, you're improving your lifespan. You're actually reducing all cause and mortality. So that ties in especially with what you're doing here in a dentistry office, because you have a lot of patients that have, gum disease and have other gum issues that are directly related to metabolic disease and metabolic issues. So
That's correct. So you mentioned metabolic is like diabetes, correct?
it doesn't always have to be diabetes. It could be diabetes. It could be, coronary artery disease, any type of heart disease, essentially. But people that don't have diabetes, a lot of times what the coin term pre-diabetes falls into that metabolic category. And that could mean that they have a elevated BMI, high blood pressure, high cholesterol, hyperglycemia. So a lot of those things can fall into the metabolic syndrome without necessarily it being considered diabetes. So you don't want to wait a lot of times for your patients to start on a therapy before, you don't want to wait until they have diabetes before you start them on therapy, because then, it's a lot harder to bring back.
That is correct. And as we all know already, like diabetes and gum disease is 1-to-1 ratio, as well as the periodontal problems can cause heart conditions, metabolic problems can cause that as well, right?
Correct.
So that's one of the things why we need to, control our weight and calorie intake. You want to burn more than what you intake.
Right? Absolutely. There's really only two ways you can lose weight. That's by reducing your caloric intake or increasing your energy expenditure. So how physically active you are, how many calories is your body burning off? Even at rest, our body's constantly burning calories, but we want to make sure that our caloric intake and our energy levels are either matching or we're reducing one and increasing the other to lose weight.
And I'm a believer in this, and I have done it. I went on a weight loss program with Dr. Nick. It's been a year since we were working together, and it's been amazing, the results that I've accomplished. And I always struggle with weight, going up and down, yoga diet. But with this medication that we can provide here at the office, I was able to start a program and manage how much food I eat and get into a habit of eating the same foods all the time at the same time, which is important. You can actually go through fasting stages and then go back and eat at your hours that you're supposed to be eating, and the food that you're supposed to be intaking, the healthy food that you're supposed to be in there. So it helps a lot with cravings, a lot with that stuff. So let's talk a little more about the medication itself, right?
Absolutely.
So what medications can we provide the patients, and how is it administered?
So the two most common medications that I personally use and have had great success with is semaglutide and tirzepatide. Both work very similar. They're both GIP antagonists. The only difference is tirzepatide has a second ingredient, which is a GIP. So they both essentially work to help the body cut the or I should say help the brain to cut the cravings. So you get a more sense of satiated feeling with eating a lot less food. You still want to eat, and you want to make sure what you're eating, it's, nutritious. You want to make sure you're eating protein. You don't want to be eating pizza and, eating candy bars. You want to still be eating highly nutritious foods, but the medication, essentially what it does is it kind of cuts and curbs the appetite. It also helps to curb a lot of those sweet cravings as well, and those savory cravings, to kind of help you to reach your dietary goals. again, we want to make this a lifestyle. We don't want to make this a, you know, a 30-day, 90-day diet, and then we go back to our old eating habits. So the medication essentially, it just helps you to establish those new healthy eating habits. And the goal is not to keep you on this medication forever. The goal is to help you to get to your weight, I guess you should say, get you to where you want to be, you know, from a body composition standpoint, and then to maintain that, and then wean you off the medication.
Yeah, and that's a very important point, because for me, for example, now I'm on a routine. Like I know, and my body knows already when I'm eating, when I'm not. You know, you can ask my staff. They know they know I need to go eat 12 o'clock, 3 o'clock, 6 o'clock, and then I stop eating for the day. But that's a routine that I already established with myself, and I meal prep my food so that when I'm here, obviously we're busy in the office, so I was like, you know, I just go back there and eat what I have to eat. So yeah, it has helped me, like, you know, reset my mind pretty much on how control myself with eating. Awesome. And then now, question on the medications: is this like Ozempic and what's the other name of the other
Mounjaro.
Mounjaro. Yeah, are they the same?
Or Zepbound or Wegovy. So essentially, they're the same active ingredients. The place where we get our medication from, it's virtually identical to the same thing as the brand that you would be getting. So it's pretty much completely the same thing. It's just the FDA changes the names or the brand, I should say, the brands change the names depending on what the FDA indication is for.
Gotcha.
So for example, Ozempic is for diabetes, you know, and Wegovy would be for weight loss, but they're both semaglutide. Mounjaro is for diabetes, Zepbound is for weight loss, but they're both tirzepatide.
Gotcha.
So they're the same medication.
It's the same compound pretty much.
It's exactly the same thing.
Got it. And how's it administered? How do people, you know, put it in their systems?
So there's a couple ways. The most common way, and in my personal experience, the best way with the best results that you get is doing a subcutaneous injection. So that's going to be a tiny little syringe. You're going to do it only once a week. It's not something you got to do every day. Literally, you only have to do it once a week. Back of the arm, in the stomach, thigh, wherever's more convenient for you. And essentially, we would titrate the dosing based off your weight loss results. Now, I personally don't like to go very high on the dosing. I think the best thing to do is to have a combination approach, to use the lowest amount of the medication as possible to, one, mitigate the side effects, and also to allow the patient to start making those dietary adjustments from the beginning.
Yeah.
Sometimes you'll see a lot of people going really high on the dose and they're not eating anything. And you'll probably hear of these things called the Ozempic face and stuff like that. And essentially what that is people are taking a very high dose of these medications. They're not eating enough nutrition. They're not getting enough protein. They're not getting enough collagen. And what's happening is their body is essentially starving itself.
Right.
So if you were to be malnourished, you would look exactly like the way somebody would on Ozempic face, because a lot of people, unfortunately, are misinformed and they take so much of the medication so they don't eat anything, and they're having some crackers, you know, or a piece of cheese all day long. Your body cannot function on that. So I always like to keep the dose small to curb those cravings, but to as well at the same time to allow you to get enough protein and adequate nutrition. And so that's something else that we're going to be making sure all our patients, we're going to be giving handouts to all our patients to kind of go over what foods you should be eating and what foods you shouldn't be.
That's correct. And what if you're afraid of needles? What happens then? Like, you just can't do it, right?
So thankfully, I believe the staff here will be able to do that. So if you're afraid of needles, and a lot of it's honestly in your head because you do not feel the injection. It is so tiny. It goes in the fat. You don't feel it. But if you guys are having an issue, I know the staff here can always
we'll do it once a week.
Administer the injections once a week for you. So you could always come in. They'll check your weight, see how you're doing, see how you're feeling. We got a whole protocol if there's any side effects, which at the doses that I personally use, very uncommon for patients to have any side effects. A little bit of nausea, maybe a little bit of constipation, but that's like the worst of it, honestly.
The main thing is drink a lot of water, right?
You need to drink a lot of water. You need to stay hydrated. Make sure you put electrolytes in your water. Don't just drink a gallon of water a day, because that'll flush out a lot of the essential electrolytes that you need to be getting in. So, but yes, you need to stay hydrated.
Yeah, the best thing that I came across was just keep track of how much water you're drinking, because you'll know, you know, because you think you drink a lot of water through the day, you just forget. I was like, I thought I drink 5 glasses. So I drink 3 of these a day, pretty much. You know, that's my standard. If I can do more, great. But it all depends on my activity levels through the day as well, and how fast, how many times I can get to the office. But yeah, 3 of these a day is my goal. More is better. The more water you have, I mean, your body composition is a lot of water, so you want to keep the water fresh in the system, I guess you want to call it, right?
And one other point too is again, if I was to give any nutritional feedback from taking these injections, the most important thing is get adequate protein in. You want to be eating protein with every meal. And another thing is, unless you're, really strict with intermittent fasting, which I don't recommend for females. Some males can get away with it, but I always recommend eating at least a minimum 3 meals a day. Right. It's a common misconception that intermittent fasting is great, and there are some health benefits to it. I would say more so for men. Women run into this issue when they do a lot of this intermittent fasting. They read these fad diets, 500 calorie diets. And what happens is the consequences for women is a lot more severe, because what it'll do is it'll slow their metabolism down so much, because the body's like, we're not getting any nutrition and we need to slow down our metabolism. So they might lose a bunch of weight, but the second they go back to eating normal again, their metabolic rate is severely impaired. And then what ends up happening is they gain all the weight back, and then they have a lot harder time losing it later on. So I can't tell you how many patients I have where they come back to me, or I just meet them for the first time, and they said, oh yeah, I did intermittent fasting and I lost 50 pounds, but I gained 60 pounds back when I stopped doing it. And it's because, again, they unfortunately impaired their metabolism. But the best way to improve that is by eating small, frequent, highly nutritious meals throughout the course of the day. Because then you're telling your brain, hey, the food's coming in. We don't need to slow our metabolism down. We actually need to ramp it up, because look at all this nutrition that's coming in. So by eating more food, or I should say more portions throughout the course of the day, what will end up happening is you'll start getting that metabolism going again. And that's the best way for women and for men, but more so for women, to keep that weight off and to make sure that they're staying adequately hydrated, and also adequately having enough nutrition essentially in their diet. So that's a big thing, because a lot of times you'll hear people, oh, my hair started falling out. Well, if you're not eating any protein and you're not getting enough healthy fats, your hair is gonna fall out. Your bones are gonna get weaker.
Yeah, of course.
Because these are a lot of the side effects that you hear with people that are doing these kinds of trendy diets, and I strongly advise against them.
Yeah, you also have like some supplements that you can help yourself out with, like fish oil can help a lot as well.
Fish oil has a whole plethora of health benefits, from brain function to reducing inflammation for arthritis. It has, there was a study done, there's a company, are we allowed to mention? So there was a company called Vasepa, and essentially what their product is it's a really high grade fish oil. And just taking the fish oil reduced the risk of cardiovascular disease by 25%.
Yes.
And reduced recurrent risk of cerebral and cardiovascular, like heart attacks and strokes, by even a greater number for those who are taking it after they had an incident. So a lot of health benefits with fish oil. Also, there's studies that show that having higher levels of omegas in your blood actually helps with hair growth, and actually helps with a lot of the metabolic and inflammatory processes that the body has.
So, and remember, guys, if you have any questions about any of this, I know it's a lot of information, just write your question below and we can answer those for you.
Yeah, absolutely.
Well. Yeah, we're happy to help you in any way that we can. Every patient who signs up, also Dr. Nate will give him a call. Okay, to make sure that, if you have any questions, specific questions regarding to your needs, he will call to follow up to make sure everything is answered to you. And obviously, if you need anything else, he can help you from that point on as well.
Absolutely.
The office is always going to be here to you can step in, like, to get your shot, and you can ask any of the staff who are taking the medication right now and see what they're going through and what the experience has been. So if you're just coming for a consult, welcome. Come in, ask the questions, and we can definitely take you from there as well. Yeah, it's awesome. Okay, so guys, if you want to get started with a program, with a weight loss program, come in for a consult. That's the first thing that we do. We ask you a few questions, make sure you qualified, and then we'll take you from there. The first shot is on us. So come in, we'll give you your shot, and you can get started right away. While you wait for the medication to come in, it takes a few days. Dr. Nick will call you. Medication comes in a few days on a box with everything in it already. So you don't even need to come back to the office to pick up your medication.
But the nice thing is you guys are also giving your patients the first shot free. So by the time you're getting ready to get your second shot, you'll already have your medication, which is nice. So you can start the process right away and you don't have to wait for the injection. So that's a nice thing that you guys are doing for your patients, for sure.
Yeah, we expect the process will make sure you get going right away. Okay, and then you can ask the questions that you have when you come in for your consult as well. Now, the $1 million question: which one's better?
Hands down, tirzepatide is much better. It's more tolerable, less side effects, more weight loss. They both work great. I always tell people, semaglutide on a scale of 1 to 10, I would give it an 8.5, 9 out of 10. Tirzepatide is 11 out of 10. It just works better, has less side effects. The weight loss tends to be much better, even at lower doses. So that's why I personally like it.
Sure.
My patients, almost all of them, I'd say 80% of them have switched over from semaglutide to tirzepatide just because of the fact that they feel better on it. They don't get as much nausea. They don't get as much constipation, and they lose more weight. And also, tirzepatide has a second ingredient that semaglutide doesn't have, and that second ingredient also helps improve insulin sensitivity, and it actually helps to reduce inflammation a little bit better than semaglutide. So
so I'm gonna share my experience. I started with semaglutide. That's how I got started, and I definitely can feel the difference when I did switch to tirzepatide. It felt way better. Like it just feels better on the system itself. I never got nausea. I never got constipation, but it just feels better on the system itself. Like I said, it works better with the insulin uptake rate.
Yep. So it helps increase insulin sensitivity, which means your body needs less insulin to meet its metabolic demands, which is good because less insulin means less fat being stored, essentially, and also less spike in that glucose. So if you're pre-diabetic, this medication is great for you. If you're trying to lose a little bit of weight, this medication is great for you. High blood pressure, you'll notice your blood pressure might come down. A lot of my patients, I take them off of their blood pressure medication after they lose 10, 20 pounds because their blood pressure normalizes because they're consuming a lot less sodium, consuming a lot less sugar. A lot of people also don't realize that sugar also increases, your blood pressure and also increases your risk of cardiovascular, cerebrovascular, and also I know probably a lot of
cavities, in your teeth as well. So, more sugar, more cavities. That's pretty much how it goes. Yeah. So some of the questions, that I had, how long will I see results? How long will it take to kind of see results? Well, mine was pretty much immediate, but I'm very active. Okay, I go to the gym every morning, and I had a routine already established to go into the gym before I met Dr. Nick. So my results were fairly quick. I mean, I changed a lot from last year to this year. It's insane. I look at my pictures and it's like, wow. I even send him pictures. Hey, look at this. That's how we communicate. I just send him shots of me myself, here and there. But yes, it's good. I mean, you can see results right away. You can feel it from the first week going on, and you see your body changing the composition. You might not see it on the scale right away, but you can start feeling your clothing feeling loose. You can start feeling more energetic as well, and you can feel more fresh, pretty much. That's how I felt.
Yeah, I mean, personally, I tell people to expect around, 5 to 10 pounds their first month, depending on how much they need to lose. If you're losing a pound a week, I'm still very happy with that because, a pound a week, that's 60 pounds a year. So if you're losing a pound a week, I'm fine with that. The first injection, you'll notice on the scale a week later that you'll probably be a pound or two less. It's very uncommon for patients to take the injections and not to lose any weight. I could tell you on one hand how many people have started therapy and said, I didn't lose any weight the first week or two, and it just doesn't happen. Okay. So, you can, start expecting some weight loss right away, just even from your first injection. I always tell patients the medicine's going to do 50% of the work. So even if you do nothing differently, which I don't advise, but even if you're going to do nothing differently, you'll still lose the weight. If you go to the gym, you change your diet up, you cut your sodas out, you start making healthier choices, the medication's going to have double an effect. So you're going to lose even more weight if you're doing all of those things, increase your physical activity levels. So even if you do nothing differently, you just simply take the shots, you'll still lose weight. I don't recommend that. I recommend you try to, make some adjustments, make some tweaks to your diet. Like I said, we'll be handing out some information for patients on some dietary things that everybody can incorporate in their diet. Very versatile. But the more you put into it, the more you're going to get out of it. So it's kind of like with anything else.
Yeah. On my personal experience, it was a lifestyle change. You know, you want to make it a lifestyle because you don't want to go into a diet, right? Because then you'll get bored and tired of the diet. Make it a lifestyle that you can handle and you're comfortable doing. That's the easiest thing to do, really. I mean, once you make that a routine, a habit, you just keep doing the same thing. Obviously, I do have my cheat meals. Like I like pizza, I like ice cream. I have 3 daughters. They, chocolate all day. So, I enjoy sharing that stuff with them. So, like I said, make it a lifestyle. You can always have your meals, like your cheat meals if you want to call them, but you serve those. You make that an effort to make sure your lifestyle is changing to a better. And again, if you have any questions, please write them below. I will answer those for you and comment, specific things that you have experienced. So if you have any questions,
I wanted to say one more thing too. The nice thing about these medications is they make you eat more intentful, if that makes sense. So like because they cut those cravings, you're not going to have those crazy sugar cravings, those crazy, fat foods, very oily foods, very sweet foods. It's going to cut those cravings. So it allows you to eat more, I guess, smarter would be the best way to put it. So be intentful with what you're eating, because now you're not going to be burdened by those crazy cravings anymore. So you could make healthier choices. And like Doc was saying, you want to make this a lifestyle. So the medication really helps you to make this a lifestyle change, because if you can keep, making those micro adjustments to your diet, which it'll be a lot easier to do with the medication, then after about, what do they say, 12 weeks, it takes to establish a new habit. So if you can do that for 12 weeks and keep making those progress, you're gonna be able to sustain that weight loss. Even when we decide, hey, you know what, we got to your goal weight, it's time to come off. If you keep those habits that you learned and that you've established during the process, there's a really good chance you're not going to gain that weight back. So
yeah, lifestyle, make it part of your day. That's all it is, right? Awesome, guys. Hey, thank you guys for joining us again. Dr. Nick, thank you for coming in today.
Pleasure. It was nice meeting you guys. I'm looking forward to working with everybody.
Awesome. See you next time.